faster UTI diagnosis. New test delivers results in hours, not days. A groundbreaking diagnostic test developed by researchers at the University of Reading, the University of Southampton, and Hampshire Hospital's NHS Foundation Trust promises to dramatically speed up urinary tract infection (UTI) treatment. The new method can determine antibiotic effectiveness in under 6 hours, compared to the current 2 to 3 day wait time for standard laboratory analysis. This advancement is not merely about convenience. It's about combating antibiotic resistance and preventing severe complications. The problem with delayed UTI diagnosis. UTIs are incredibly common, leading to over 800,000 hospital admissions in England alone over the past 5 years. Critically, roughly 25% of urine samples tested in NHS labs reveal bacteria resistant to common antibiotics. The current delay in diagnosis often means patients either finish an ineffective course of antibiotics or risk their infection escalating into potentially life-threatening sepsis. The issue isn't just about patient discomfort. It's about the accelerating crisis of antimicrobial resistance. Inefficient treatment drives antibiotic overuse, which in turn fuels the evolution of resistant strains. How the new test works. Direct analysis for rapid results. The new method bypasses the traditional overnight culturing process, which is the main source of delay. Instead, the test uses a cartridge containing preloaded antibiotics. The cartridge is inserted directly into the urine sample, and an instrument uses optical imaging to monitor bacterial growth. If bacteria stop growing in a tube, the corresponding antibiotic is effective. If growth continues, the antibiotic is ineffective. This streamlined process provides doctors with actionable results in less than 6 hours, enabling targeted treatment from the outset. Validation and accuracy. 97% agreement with standard methods. The test's accuracy was rigorously validated in a study published March 31 in the Journal of Antimicrobial Chemotherapy. Researchers analyzed 352 urine samples, finding 96.95% agreement with standard laboratory methods across 7 commonly used antibiotics. A separate experiment using 90 duplicate samples confirmed that the test remains accurate even when using urine samples preserved with boric acid, standard practice in clinical settings. The preservative showed 98.75% agreement in results, meaning it doesn't interfere with the diagnostic process. This is the first study to demonstrate this level of consistency for rapid direct-from-urine testing. Industry and NHS support. Scaling up for real-world impact, the test is being commercialized by Astratus Limited, a spin-out company from the University of Reading. CEO Dr. Oliver Hancock emphasizes the urgency. By the time the laboratory delivers the result under current methods, a patient may already have finished their antibiotics or been given ones that do not work. The National Institute for Health and Care Research, NIHR, funded the research, and Professor Mike Lewis, NIHR Scientific Director for Innovation, highlighted the broader implications. This NIHR-funded research not only has the potential to deliver quicker, more effective treatments, but also tackles the broader challenge of antimicrobial resistance. With around 65 million urine samples analyzed annually in the UK alone, the potential impact of this faster, more accurate diagnostic method is substantial. A test that works on samples we already collect as standard and gives us answers the same day is exactly the kind of tool that could change how we manage these infections in practice. Professor Matthew Inadakim, consultant acute physician and AMR lead. The rapid urine test marks a significant step toward improving UTI treatment and addressing the global threat of antibiotic resistance.